everyone, this is Dr. Shinam Bansal. Today we will do how you can prevent the mistakes which we can usually do while applying plaster in the patients of CT. Firstly, we can see in this child, this is a CTEV patient. Here, first cast is applied in supination uh, and in abduction. And in next cast, we will not supinate as we do in the first cast. So let's see. Firstly, don't evert forefoot rather than supination and abduction. The main funda is we have to supinate and abduct. Don't evert forefoot. Don't evert forefoot. Otherwise, it will lead to increased cavus and cavus will become rigid as plantar fascia thickens. Next, we can don't correct foot supination by forcefully pronate. Forcefully pronation will lead to breach in the midfoot cause calcaneus will remain locked in inversion. We have also to abduct the calcaneum. So take the foot as a unit. Don't forcefully pronate. Otherwise, it will create a breach in the midfoot. Then don't externally rotate the foot while heel is fixed in the varus. So if heel is fixed in the varus and you are externally rotating the foot, what will happen? It will externally rotate the talus and which will ultimately displace the lateral malleolus posteriorly. Don't correct foot adduction by abducting the forefoot against pressure at the calcaneocuboid joint. Otherwise, what will happen? It will prevent the abduction of the calcaneus. Means in every case we are saying you don't have to move a forefoot out of the hind foot. You have to take it as a unit. You also have to take calcaneum along with it, and every movement should be under the talus. Don't correct heel varus by everting the calcaneus. Don't correct heel varus by correcting the calcaneus. Otherwise, you have to abduct the calcaneus under talus. You don't have to evert. You have to abduct. The main funda is supination and abduction. In the first cast, you have to supinate, and from the next cast, you have to abduct. Don't apply below knee plaster cast instead of toe to groin. Cause what will happen? It will allow the talus to rotate, and when talus will rotate, everything is under the talus. If talus will rotate, manipulation is lost. So foot is held in abduction under the talus. If talus is rotating, then there is no fun of manipulating the foot. Don't correct aquinas before other components of the deformity. We know it will lead to rocker bottom deformity. You don't have to dorsiflex the forefoot alone because it will also lead to rocker bottom deformity. Don't do prolonged immobilization. Otherwise, what will happen? It may lead to osteoporosis and excessive loosening of the normal ligaments in front of the navicular and cuboid. It will lead to osteoporosis and excessive loosening. And if you are don't transfer TA tendon, what will happen to TA tendon to the fifth metatarsal or to the cuboid? You have to transfer it to the third cuneiform. Otherwise, what will happen? Excessive foot eversion will happen. And don't split half tibialis anterior to the lateral foot. Otherwise, what will happen? It will correct the dorsiflexion but doesn't correct the foot supination. To correct the foot supination, tendon must be transmitted to third cuneiform as a whole unit. So this was all about the major mistakes which we can do while applying plaster application, and we can cause the iatrogenic deformities in CTV rather than correcting it. So these were the major things you have to take in mind.